Hello, doctor and medical students. I'm Dr. Amit. So let's dive into the final short review of hemorrhage. Today we'll have a quick revision of treatment of hemorrhage in a simple stepwise manner. So the first and most important step is restoration of blood loss. It means that restoration of the circulating blood volume. So this can be done by one is blood transfusion, then crystalloid solutions like ringer lactate, normal saline. Then we can also use colloids as a restoration fluid in blood loss like albumin, then hemicil, which is a gelatin solution. Then after then we can use dextran and plasma infusion. We can also use SAG-M blood, that is saline, adenine, glucose, mannitol, preserved packed red cells. So this can be used as a replacement fluid in case of blood loss, and 1 unit of blood usually raises the hemoglobin by 1 gram per deciliter. Now the second important step is catheterizations, positioning and monitoring. Urinary catheterization is important to monitor the urine output. Then foot in elevations may help venous return temporarily. Then continuous monitoring of pulse, blood pressure, respiratory rate and urine output is essential in case of blood loss. Then the third important step is oxygen support and critical care. That's why oxygen supplementation should be given, and if needed, then intubation and ventilator support is given in case of severe cases. Then ICU or critical care support may be needed in cases of unstable patients. Then the fourth most important step is if there is active bleeding, then control of active bleeding is one of the most important steps. So it can be controlled by direct pressure and packing are a useful method to control hemorrhage. Then Trendelenburg bug positions or head down position may help temporarily to maintain the cerebral perfusion in severe hypovolemia patients. Then the fifth important step is wound exploration and surgical management. So the definitive surgical control may include ligation of the bleeding vessels, after then suturing of the wounds, then repair of the injured vessels, and if there is devitalized tissue, then excision of those devitalized tissue is very important. Then the sixth important step is rest, analgesics and sedation. So absolute rest is very important. Then sometimes analgesics and sedations may be required to relieve pain and anxiety. Then in some patient, morphine can be used carefully with monitoring. Then if the patient has hemothorax, then management of hemothorax is also important step. So to manage the hemothorax, we need to put ICT, that is intracostal chest tube drainage is very important to manage the cases of hemothorax. So we need to place ICT in the patient. Now the eighth step is if there is any sort of internal injury, then laparotomy is important for internal injuries. So emergency laparotomy may be required in case of liver injury, after then spleen injury, then mesenteric injury, then bowel injury. So those procedures may include suturing, then repair, then sometimes splenectomy in some patients. Then sometimes topical hemostatic agents is also needed in some patients. So it is mainly done for local oozing. So we mainly used oxidized cellulose, or we can also say the oxycell. Then we can use soaked gauze in adrenaline. Then bone wax for bleeding from in case of bone bleeding. Then we can also use other local hemostatic agents in case of local bleeding. Now it is also important to know how to manage if there is a venous hemorrhage. So in case of venous hemorrhage, so the treatment include like elevations of the affected part, then pressure bandaging, then packing, after then ligation of the vein, and suturing of the venous wall in case of large vein bleeding. Now it is also important to know the tourniquet use in case of hemorrhage. So the tourniquets are commonly used in operation theatre for hemorrhage control in limb surgeries. However, the use of tourniquets are generally not advised as a routine first aid measures unless severe life-threatening limb bleeding is present. Now at last we'll talk about some supportive management in case of hemorrhage. So important supportive measures like one is electrolyte corrections, then central venous pressure monitoring, after then nutritional support by TPN if required, then antibiotic support to stop sepsis from occurring. Then in some patients we need ventilator supports, and steroids are injected in some selected patients according to the clinical scenario of that patient. So that is all about the treatment of hemorrhage. Okay, so we have discussed that classification of hemorrhage, pathophysiology of hemorrhage, clinical feature of hemorrhage, ATLS classifications, after then how to measure the blood loss, after then what the effect of hemorrhage on the body, and today we discussed about the treatment of hemorrhage. So it's a small short review on hemorrhage. Thanks for watching. If you like my video, please subscribe my YouTube channel at the rate Dr. Amit Official, and please share with your fellow medicals. Thank you.